Overall, you have a healthy smile, but then your dentist tells you have a tooth that died. How can that be? And what does that really mean? Dentist Steve Marsh is here to show how your smile's life can go on even after a tooth might bite the dust. So welcome back to the show.
Thanks, Lori.
What exactly is a dead tooth?
So a tooth, if a tooth dies, it means the nerve and blood vessels died. And though I use a lot of digital work in my office, I just thought I'd use this old school picture of a tooth. So the outer tooth is enamel, then dentin, and the pulp is the main nerve of the tooth. That's what this is. It's blood vessels, it's collagen, and it's a nerve. What happens is, and I'm going to rotate it, in this case you see decay that's reached the nerve, and when it reaches the nerve, it'll actually kill the nerve. And that's why dentists are so worried about taking care of decay before it gets beneath this layer. This is enamel, very hard, dentin is soft. If it gets to that, it can cause an abscess. You see the picture at the bottom, and that's what happens. The nerve dies, there's blood, there's necrosis goes on, and there's pressure at the end of the tooth. And when you bite down, you say, oh my gosh, my tooth is killing. So it hurts. You've
got some clue what's going on because it hurts. But if you make it through the pain, can you just sort of like let it go and let the rest of the teeth do their thing?
Well, I have to tell you, Larry, some people do, but what happens is sometimes you have this intense pain, and given some time, maybe an antibiotic, it seems to go away. Generally, it means the nerve has died all the way. And sometimes you'll then get a swelling. It can be a week, a month, a year later. And that's the body trying to take care of this increasing infection, and it literally pushes out through the tissues.
What do you do at that point?
Well, that's when you do a root canal. And you always hear, first of all, the name root canal is, it creates problems just by the name.
Shivers.
Shivers. But what it means is, and I showed you the picture of the tooth, what happens is you actually denerve the tooth right into that canal where the pulp is. It's removed. And then it's filled in with a material called gutta percha and some cement. So you still have a tooth that functions well, can do very well. It does become brittle, and it can become dark. In this picture, the picture on the left is the before. There's some of the digital x-rays we have in our office. And the one on the right, if you look at the tooth, the large tooth, that's the molar. On the picture on the right, if you look very closely, you'll see a darkening at the back root. That's all the way to the right. That's how the dentist can see that an abscess is forming. It literally eats away at the bone. So that's when a tooth has to have a root canal.
Okay, so you've got some pictures to show before and afters, huh?
Yeah, and this is a young woman who was 32, and she had fallen. Often it's from sports. It can be falling off a bicycle. She fell off a bicycle. You can see the front two teeth turn very dark. That's one of the issues that I mentioned. And so we came back, we did some bleaching of her teeth, and then actually put 4 porcelain veneers on to give her a beautiful smile. Oftentimes we do this internal bleaching. It's not very stable, so that's when we go ahead and put veneers on a tooth.
Okay. Do teeth have to actually come out with a root canal?
No, they don't. We try to keep them in.
That's great.
Here's a patient who had worn down his teeth, sleep apnea. He had root canals, and Lori, it shows during, you can see where I've built the teeth up. After the root canal was done and the nerve was taken out in the blood vessels, we then put a ceramic post in each of those teeth, actually 6 teeth, and then built them up with a composite material. And then on top of those, we then came in and gave him this smile. You can see the lowers have not been touched yet. He wanted very white, very bright. He had suffered all those years. And I will also tell you that following treatment, we put him on a sleep device to help with the sleep apnea, so he didn't wear these teeth down.
You didn't grind those back down, right?
Because, yeah. And so what else do we do when we lose a tooth? This is a young girl, 22 years old, a nurse, broken a tooth, had a root canal. Sometimes root canals take care of the problem. Oftentimes they don't. And if the tooth then responds with more pain or more fracturing, the tooth had to be taken out. In this case, she was young enough where we were able to do it in implant. She had a lot of good bone. There's the during picture where we put the implant post in, and we subsequently have a finished result.
An amazing result.
Right. So again, here we did the implant post and crown, and then did some porcelain veneers and whitening on her lowers to give her that beautiful smile. So we try to avoid root canals in the first place, but if it happens that the nerve dies, there's a way to work with it and combat that.
You can still do something. So a dead tooth is not the death of your smile. With the right treatment, you can give that tooth a new life and have a lively smile for years to come. To find out more, give Steve a call. His number's next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com.